Jack.
How are you, John?
Very good, mate. Today, we thought we would start to touch on an area that I think is slowly creeping into more and more of the physical therapy space and sort of the physical medicine and rehabilitation space, which is creating and having a nutritional environment that actually supports the healing process. I think we've known this for a long time, and it's probably been something that in sports performance people have kind of looked at in much more depth. You know, the understanding of supplementation in that industry has been something that's been investigated to a reasonable level. Some things to really good effect, some things don't seem to work very well at all.
Absolutely.
But they're still popular. However, something that's become really interesting, I think, in this space is the idea that in healthcare, and particularly in physical medicine, so in areas like rehabilitation, in order for healing to take place at its most optimized level, you need to provide, one, the mechanical stimulus to actually upregulate that tissue. You know, there's been a lot of research looking at changes to tissue architecture, whether that be bone tissue, tendon, muscle. And the second factor that seems to be coming along that's paired with it is, if you're going to create that mechanical stimulus, do you actually have the nutritional support of the building blocks that are needed to actually create that adaptation? So we've started to see a lot of research, particularly in areas, well, previously it was a lot in muscle and intake of, say, protein. A lot of really good research done on the aging spectrum. People like Stuart Phillips has done a lot of work looking at that. We've known for a long time, for instance, in endurance training, that carbohydrate intake, you know, even a lot of really good high quality studies have come out of Australia. People like John Hawley, Louise Burke have done a lot of work on, say, endurance capability. And so that's more at a systemic level. But we're now starting to see a lot of research looking at things like, say, tendon health and the intake of type 1 collagen. Particularly whether it's in the form of gelatin or whether it's in some sort of hydrolyzed collagen supplement. And to me, more recently, and I think we mentioned this in the podcast, I've been thinking about this concept a lot of, are we doing our patients a disservice if we're implementing, say, the rehabilitation and providing, say, that mechanical stimulus? We're giving them exercise, we're giving them, you know, this idea that we're going to drive the adaptation to that tissue for, you know, whether it's healing or long-term benefit. But if we're not giving them the advice or the input of, say, you know, a dietitian or a nutritionist to actually give them the building blocks, are we actually letting that person down?
Yeah, and that becomes very evident, particularly in younger populations and older populations. Like, not saying that it's not relevant to adults, it absolutely is.
Yeah.
But it's interesting to note that you notice the significance of nutritional or deficiencies or caloric deficits, I should say, particularly at those two ends of the spectrum. And that makes a lot of sense because of, obviously, for a child or an adolescent, there's a lot of physical development going on, but also for an elderly person, there's a lot of issues associated with absorption and assimilation of nutrients.
Yeah, and that's, you know, I mentioned Stuart Phillips before, and he's done a lot of research showing that even for protein intake, there needs to be more protein intake to induce the same level of upregulation of muscle protein synthesis in older populations, because, as you said, the sensitivity of their tissue to be able to actually respond, even in the presence of that mechanical stimulus, so like strength training or resistance training, it doesn't upregulate to the same level as someone who's, you know, younger. And
there's actually, speaking of older populations, they're a good example of the interaction between mechanical stimulus and nutritional stimulus, which I think we've talked about this before briefly, that just simply increasing protein intake in elderly people doesn't lead to that significant change in terms of creating enough anabolic stimulus and getting, say, improvements or at least maintenance of cross-sectional area when you think of, say, muscle or skeletal mass. But it's the requirement of utilizing that mechanical stimulus to upregulate certain cellular pathways, in addition to then making sure that the appropriate building blocks are there. And it actually makes a lot of sense when you think about it. I mean, you can have all the appropriate anabolic signaling that you want, but if you don't actually have the adequate building blocks, you're not going to see changes within the tissue.
Yeah, and that makes perfect sense. I think, and that's why I've been thinking about it a lot, and I know we had this conversation in private about this idea of requiring both the mechanical stimulus and the nutritional intake in these older populations, and it made me think that's probably happening quite a bit at a younger level too. It's just that because of that resistance or the anabolic resistance you see as people get older, it's more evident and it's visible at a really basic level. However, when it's happening at a younger age, we don't notice the discrepancy as much. But we're seeing so many people even now that I think who have altered their nutrition or have, for whatever reason, some of them are religious, some of them are social reasons, some of them are moral reasons, they choose not to eat certain foods. But we're actually already starting to see the health benefit, and we're actually experiencing that from the point of view of their physical health is deteriorating, and we're seeing slower healing times, we're seeing increased risk of injury.
Absolutely.
And it's a difficult conversation to have because there seems to have been this linking with morals and ethics around eating food. However, for your health, it seems like there are certain nutritional factors that you will optimize your health if you eat them.
Yeah, and look, I think that becomes very evident when you look particularly at bone health.
Yes.
It's becoming quite obvious that, well, any tissue in the body requires certain nutrients, but for bone, we know that we need something like vitamin D, which also relates to some of the environmental factors that
like
we spend too much time indoors, simply, and then you could need to take into consideration, say, obviously calcium being a really important one, which the reality is there are some plant forms of calcium, but a lot of it is related to dairy consumption. And that can be problematic because obviously some people do
lactose intolerance
or may not tolerate dairy. But then associated, the other big factor too, and this is again very evident when you look at elderly people, is the protein consumption, particularly with regards to fracture risk in elderly people. And we need to think about not just the amount of nutrients we're getting in, but also the actual sources of where we're getting them as well.
Yeah, I know you always talk about this, the synergistic factors that happen by getting them from whole foods versus getting them from supplementation.
Yeah, and look, I mean, that's quite evident when you look at the literature. It's actually interesting to note that, one other important factor, and this is very relevant for athletes, is how you actually deal with the side effects of applying a lot of mechanical stress when we think of, say, oxidative stress and inflammation. And there's a lot of suggestion or evidence to show that things like antioxidants can help make sure you maintain good redox status. So redox status is simply related to the amount of oxidative stress relative to the amount of antioxidant defense enzymes. And so you've led to a lot of things of, say, consuming vitamin C as a supplement is a good example. But it's interesting to note that high consumption of vitamin C in isolation can actually attenuate certain physiological adaptation. You actually see that a lot in endurance athletes. So it's interesting too, because when you look at nutrition, there's a couple of things from this. One, there is actually a hormetic response happening, because too little of something is problematic, but too much can also be problematic, because you actually need a certain amount of oxidative stress and inflammation that provides
to drive
signals.
that adaptation.
Exactly. Adaptation of a particular system doesn't occur in a vacuum. You have that interaction of the musculoskeletal system with the immune system that provides the signals to regulate change in the tissue.
Yeah, I know that even, you brought up some really interesting discussions in a previous chat that we had about, that kind of training increasing things like myokine expression and as, that alteration in the immune system. I think that it's really important that you highlight that, because I think this interaction with nutrition is part of this more, holistic approach and complex approach to the healthcare side of it. For us, obviously, we're looking at physical health, but it's really important to kind of get the message across that these things, as you said, don't operate in a vacuum. If you do intense exercise, it's affecting lots of systems in your body. And in order to actually replenish and recover that, you need to utilize strategies that recovers lots of different systems. And
absolutely.
That's why, the key things that tend to go into that recovery process, the big ones are going to be things like sleep and nutrition.
Yeah.
Because they are the things that will have the biggest and greatest effect on reducing, say, the immune, or at least improving the immune status that you actually currently have, or around the time of being exposed to that high level of, say, physical stress.
Yeah, absolutely. And it's an issue that we have at a global level or at a societal level, where we don't have an issue getting enough calories. And I think that's a probably important distinction to make when we talk about food and nutrition.
Yeah, we've spoken a lot about wanting to get a dietitian, nutritionist on, and I think this is one of the key questions that we want to ask.
Oh, absolutely.
And obviously, this isn't an area of expertise of ours, but it's an area of interest because it is starting to very heavily intertwine with the results and the physical health of the people we're dealing with.
And
so
more
our knowledge
importantly,
we're trying to grow our knowledge in this area.
Well, about this, exactly. And more importantly, like anyone working in healthcare has to have an understanding of how these systems interact, because then you can identify if there's a potential problem. But I mean, this is something that's very evident when you look in our society, where we get enough nutrients, we're getting enough calories in our diet, we're getting enough energy to provide cellular metabolism, but are we actually getting enough of the nutrients when we talk about vitamins, minerals, and the other big ones, of course, are amino acids and essential fatty acids.
And it's funny you say that because I think it's a contention that both you and I have, which is that the commonly used phrase, that it comes down to caloric intake. When it, say for instance, if it's in weight loss, understanding to manage your calories is the greatest factor. And I think you and I have always pushed against that, because there's a very big difference between macronutrient content, being the distribution of carbs, fats, protein, and how many calories that is, versus the micronutrient content of what you eat. So as you said, it's not hard to get calories.
No.
And it might even be from those macronutrient groups that people suggest you should get.
Absolutely.
But what's the quality of what you're getting? And I recently went to a conference that was actually on women's health and in sport and injuries and things like that. And I got lucky enough, I went and actually had a chat with Louise Burke, who's been the AOS dietitian, sports dietitian and nutritionist for a long time. And I asked her that direct question, is it just calories in, calories out? And she was really good about it. She said that there's lots of evidence suggesting in, say, athletic populations, we obviously need to maximize the amount of carbohydrate intake, particularly for people doing intense exercise. And that flies in the face of some of the more popular things that have come across in the last 10 years. You had people like Tim Noakes and even Peter Bruckner, who's really popularized the idea of, the high fat, low carb.
Which may be appropriate for certain population groups.
Potentially,
absolutely.
yeah, but Louise was actually very heavily involved in a number of studies with, I think it was the walkers that they did it with, to try and see actually what happened. And they tried to even fat adapt them and all these kind of things, and they still just didn't get the benefit that they were hoping for.
Well, and that also makes a lot of sense when you think about energy kinetics, because think about explosive activities where you need readily available energy. What's the most readily available energy at the actual source of the muscle? Phosphocreatine and glycogen.
Yeah.
So you're really going to be limited in terms of your ability to actually metabolize and transport and oxidize fat in an appropriate time frame to be able to accommodate that explosive nature.
So that was one of the key things that she brought forward. But the second one was that we would always recommend people eat whole foods rather than supplement, and we would always rather them eat natural foods or naturally occurring foods rather than artificially produced foods, packaged things that have been fortified. She said, if you have to have those things, fair enough. For whatever reason you don't have availability, or someone doesn't eat a particular thing, or whatever it is. But ideally, we want you getting it from whole food sources. So if you can get your iron from meat, you're better off getting it from there than iron tablets, right? I think that makes perfect sense to most people, but I think that there's going to be a growing body of evidence, and you probably know this better than I do, that those synergistic factors are going to become increasingly seen as being important.
Absolutely. Well, there's a couple of things to take away from that. Is like what you're highlighting here is the whole food matrix, and understanding that the absorption and assimilation of nutrients doesn't happen in isolation. And there's very good evidence to show that. I know some of I can't think of his first name, but it's a Dutch guy who's a researcher at the University of Kentucky, Van Vliet. Who's done some interesting research of looking at, say, consumption of a whole egg versus just the egg whites, and thinking about, the egg yolk doesn't actually provide much protein, but has a lot of fat-soluble vitamins and fat that's shown to actually increase protein.
The absorption,
protein synthesis. And I think the other thing that's interesting too is we also need to understand and appreciate that even our understanding of nutrition is still very much in its infancy. And I think that's related to a lot of the secondary and tertiary metabolites, well, not metabolites, but actual micronutrients within food. So I think this is very relevant and relates to your point before about saying looking at tendon and the consumption of collagen, because a lot of these types of amino acids, for this example, get dismissed because they're not considered essential amino acids. But it's interesting to note that they are now starting to look at them as more being, say, semi-essential or additional, because people who have low collagen diets will typically have amino acids that are high in collagen lower within their plasma, so particularly glycine and proline. And it's interesting to know that when you look at, say, whole foods too, and they've done some interesting stuff of looking at meat. I know the Van Vliet's done some interesting stuff of looking at a lot of the other amino acids in, say, meat that are actually really relevant for your physiology. So things like carnitine, carnosine, taurine, anserine, all these other ones that you may or may not have heard of that are actually really important amino acids for certain cellular signaling.
Okay. You brought up meat. Right? It's probably one of the things that we get asked often. And I think it probably these days is an interesting and touchy topic for some people.
Absolutely.
Maybe not for us, but for some people. There's become a huge popular movement towards consumption of less animal products. And also, I think it seems to have normalized a little bit, but previously was, the upsurge of things like veganism and no animal products at all. However, there does seem to be a growing body of evidence, at least in the areas that we're looking at around physical health, that being omnivorous is the best option for maintaining your overall global health. One of the things that I think you and I both struggle with is being able to get that message across, because there seems to be a lot of experts, whether they be online or even actually in some of the literature, that I think are using the popularism of these kind of movements and even ideas around, like, say, environmentalism to push an agenda that not eating, say, animal products is healthy for you or healthier for you. But the data doesn't seem to support that. And I think it's creating a reasonable challenge, actually, for health practitioners to be able to navigate that space without necessarily stepping on people's moral position, and not wanting to necessarily go into an ethical discussion with them, but rather putting forward information that's valuable for them on a health level.
Yeah, look, we're getting into pretty contentious waters here, aren't we? But I'd start with saying that...
Well, I don't know that they're contentious. I think people choose to not eat animal products for various reasons. Some of them, I think, are probably more accepted than others. But the reality, to me, at least with the available data that we have, is that, as I said, being omnivorous is beneficial. Compared to any other extreme diet, whatever it is.
Well, look, there's obviously people that would argue that, but a lot of that's really based on these observational studies where you have big issues with, say, healthy user bias, because, if you look at the narrative around nutrition, a lot of it's been very anti-meat for a while, and associated with that means that people who are typically healthier, that is, are more physically active, have lower, say, fat mass, spend time outdoors, all these things, they may eat less meat because they think it's a healthier option, as opposed to people who
don't consider those things at all.
Unfortunately, the reflection of, say, most people in Western civilization who are overweight or obese, completely sedentary, eat highly processed food and consume meat. You might not be able to identify the fact that correlation doesn't mean causation.
And I don't really, these days, I think you and I used to get a little bit more caught up in this, but I don't really see it as a judgment on anyone's choices, rather than giving them the information and saying, this is what the evidence is suggesting. You obviously have the choice about how you're going to approach this from your own health perspective.
Well, I'm about to say, part of that's just putting into context, because, if you think about someone that comes in with any particular presentation, if they have a diet where they feel like they're thriving on and they're not having any health issues, then it's probably going to be pretty hard to convince that person to change. But then if you see that there are particular issues associated with, say, poor diet, or potentially missing certain nutrients within their diet, so they're having multiple stress fractures, multiple soft tissue strains, there's obviously going to be a lot of factors associated with that. They may be related to mechanical factors when we think about tissue capacity or biomechanics, but there's also a big potential that nutrition is going to be also a relevant factor if you start to identify deficiencies within their diet. So part of it is really putting into context for that individual. Because if that's the case, then you need to be thinking, well, do I think this is actually relevant to this person's presentation? And if so, how do I actually create changes within their diet? And again, this might be going outside of our realm when you begin.
Well, yeah, I think that's one, we put this out there to say, obviously we're having this discussion and it's important for health practitioners who work in, say, the physio space or physical therapy or whatever area of that, or even whether it's, as a sports medicine physician, all those kind of things. We say, you need to have this understanding. You clearly at a certain point need to bring in other practitioners. You need to be working with nutritionists and dietitians to be able to maximize on these things.
Absolutely.
I think the biggest part for us in working and being involved in this is being able to identify these things and even ask the relevant questions to get an idea. You're more acting maybe as a screening for that. Having that conversation and saying, cool, look, I actually think this is a bit of an issue. These are the people that I would recommend that you go and speak with, liaise with them to try and work with that health practitioner to try and get the outcome that's going to help support what you're doing on the physical health side of things.
Yeah, absolutely. And look, the reality is I've certainly seen patients where you can identify diet as a big factor to it.
Of recent, I think it's probably been a number of cases that I've seen, and it's a primary driver of the issue. And
absolutely.
It's making it difficult because sometimes they'll get frustrated with you and say, well, I'm doing all of the physical things, and you say,
absolutely.
yeah, well, that's true, but you actually don't have the environment, the building blocks to actually support the activity that you want to do.
Totally.
So your body's slowly breaking itself down to be able to carry out that task.
And this has a lot of relevance to a lot of just general pain conditions that we see if we're thinking of outside of athletic populations. I've had a patient before who's had fibromyalgia, and there's actually a lot of evidence showing how there's a lot of nutritional deficits and supporting your system with certain nutritional interventions that helps that. And this person definitely has issues with her diet, and she's someone who also is quite overweight, so she's going to have a lot of underlying imbalances within her immune system because of her lack of muscle mass, which we've talked a bit about before, but not only doesn't provide the ability for locomotion, but actually works as a secretory organ itself. Every time, one of the big benefits you get from exercise is contraction of the muscle or even the whole myofascial system secretes myokines, which is a very important cytokines that regulate the inflammatory process and typically have a very anti-inflammatory nature. In contrast to, say, adapokines, which is secreted from your fat mass, that typically create pro-inflammatory state and that typical low-grade systemic inflammation that's associated with a lot of chronic diseases, including a lot of pain issues. And I think this is something that we need to also be mindful as clinicians if we're working in the general population, that a lot of pain conditions are not just related to the irritation of
the actual pathology of a particular tissue itself.
Correct. But also understanding how the inflammatory response associated with an injury is going to be regulated by so many factors, and that being related to diet and fat mass.
That makes me recall, that paper that you shared with our clinical group on, say, the presentation of spinal and back pain, and how particular pathologies without the presence of an inflammatory response do not typically demonstrate symptomatic pain symptoms.
Yes. Whereas
if you have, say, some sort of disc protrusion with an inflammatory response, you get the corresponding symptoms and pain. I found that super interesting that, for instance, you could have two people with a similar presentation of, say, degenerative disc disease, and one who's really healthy, as you said, has low fat mass, is exercising regularly, and so their inflammatory status is very good, versus the person who isn't exercising a lot, has more fat mass, isn't in an inflammatory status that would be considered healthy, and they're going to present actually with the back pain, even
Absolutely.
though the pathology of those two people under, say, imaging would be very similar.
And this also has a lot of relevance when we think about the regulation of balance between catabolic and anabolic factors for tissue that isn't as metabolically active. So an example of this again is tendon tissue, which seems to be much more sensitive to mechanical loading and the nutritional status of the individual compared to, say, muscle mass, but then particularly with articular tissue. And I remember we had a discussion about this last year of looking at the process of autophagy for intervertebral disc regeneration.
Yes.
So autophagy is a process that's used, which essentially describes cellular cleaning. So it's like trying to...
Your immune system goes around cleaning up dead cells.
Exactly. Now, it's interesting to note that autophagy only occurs in certain states. One of them is fasting, or a calorie deficit state, or potentially like in a ketogenic physiology. But the other issue that we see, and this is particularly prevalent for the general population, is do people provide a big enough window of fasting or, consume
eating all
less
the time.
calories
Yeah.
to actually upregulate those autophagy? Because typically it's associated with upregulation of the AMPK pathway, which happens through, say, endurance activity or, say, fasting as an example. And so because if you look at the ability for cells to replicate in, say, articular tissue, it's very low. But what can happen with autophagy is as it starts to degrade tissue, it can use those biomaterials to help then regenerate, particularly the extracellular matrix within the tissue, and maintain a certain amount of tissue health, so to speak. And so when we think about conditions such as osteoarthritis, or I think actually another good example of this is certain tendinopathy issues like lateral hip pain with, say, gluteal tendinopathy. There are certain population groups that you see it in, and typically they are, middle-aged people, people typically who have low physical activity, high fat mass. So they've created not just a poor environment to maintain certain mechanical or tissue capacity, but also when we think about their immunological and metabolic status or dysfunction, you start to see a lot of dysregulation of these very sensitive tissue. And so I think this is something that's often missing when we look at, say, can we actually start to remodel connective tissue structures? And a lot of people would say no. And to be fair, there's a lot of evidence to suggest that's not the case when we just look at applying, say, mechanical stimulus only, because we need to consider the nutritional status and also just the overall health and well-being status that will determine how responsive that tissue is to being able to regenerate itself.
Yeah, in preparation for this, I was thinking about it, and I know I shared a paper that I think you'd shared already anyway, but it was looking at what nutritional intake you could have for different tissues, and particularly for different types of injuries. So I think if we go through that, it might be useful for listeners to kind of get a bit of an idea of what kind of things might be supportive for different injury types, but also different tissues. You mentioned bone before, and I think it's really clear that there's a few things that contribute to that sort of process. And I know that you've spoken about people like Stuart Warden before. He's got some really good research on some of these areas, but it's really clear that there are certain characteristics that really optimize things like bone density. Now, the unfortunate thing is that typically most of that is done earlier in life. So if you haven't started doing it, or you haven't had exposure to those, whether it be nutrients or also those factors in relation to mechanical loading, you sometimes don't get the benefits later in life. You still maintain some mechanical sensitivity, but you may not ever have the bone density of someone who has been doing it for a much longer period and through the sensitive years of that development.
And that probably then relates to understanding that when we think about bone strength, we can think of quantity, quality, and organisation. So quantity might be more compromised because you won't build up as much density, so to speak, but certainly we can see changes in the quality or organisation of it as we apply mechanical loads.
So if we like, and I guess you're much more knowledgeable on this stuff than me, so I might even ask you questions. But say for bone, what are the key factors that seem to be supportive of bone tissue and healthy, high quality bone tissue, as you said? I think we preface this by saying that there is evidence, and you can read some of this stuff. As I mentioned, Stuart Warden's probably the person that you want to go and chase down, who has suggested that you want to get, particularly for females, you want to get this stuff laid down in your development years as a teen. So those are the key things. I'm actually going to go turn that off, Joe.
Yeah, sure.
Give us
a brief interim. Well, look, there's clearly certain nutrients that have been very well established as being very important for bone metabolism, and these are the ones that most people have heard of when we think about vitamin D, calcium, and protein consumption. I think the thing that we need to consider too is, again, any metabolism of any tissue doesn't happen in a vacuum, and typically even if you look at the actual biochemistry, there's actually a lot of cofactors involved. So for instance, we know that, say, magnesium is really relevant for essentially as a gate for allowing calcium to enter bone. Another really important one that often gets overlooked or forgotten about is vitamin K2.
Yeah, and where do you, like, I know you've mentioned this a lot, what are some of the sources of vitamin K2 that you can readily get?
Well, the big thing to understand is people have heard of typically vitamin K, but you need to differentiate K1 and K2 because they have very different roles in human physiology. Because K1 you can get a lot from basically like green leafy vegetables, but it doesn't have the ability doesn't play the role of K2, and it can't be converted to K2. So K2 is really important for calcium metabolism, ensuring that it provides, or calcium gets into hard tissue like bone. In addition, it's actually really important for hormonal health. But K2 typically is from animal products, so you'll see it in eggs, you'll see it in a lot of fermented dairy, like a lot of cheeses. You do get it in organ meats too. Liver, I know, is one. And then it's an area that still needs more work and knowledge, but like a lot of meat will get it. I know pork, I think in particular, does, and I think darker cuts of chicken, like chicken thighs.
Yeah.
There's some really interesting stuff that Chris Masterjohn has. He actually has a K2 database and calculator that you can look at, and he talks a lot about K2, so he's certainly a really useful resource to look at for understanding where you get K2 from. But something that I know that I play around with myself, and actually I'll often get patients to do it just so they can try and quantify, is there are really good apps you can use to write down what you've consumed and get an overall idea of your
look, again, we'll state that this is not necessarily our area. So what we would suggest that anything that we say here, we suggest that if you're someone who's looking to explore this, do so with a practicing a registered dietitian or nutritionist. Absolutely. To kind of explore some of these things. But for the health practitioners who may be out there and listening to this, what we're hoping that you get out of it is that maybe it gives you some awareness to be able to ask questions and identify this, so that you can then work with other professionals. We're not recommending anything, and we're not suggesting that you start by any means prescribing anything.
No.
But be aware that these factors definitely have influence on, say, the physical health of, say, tissue.
Well, and I think the useful thing about, say, using an app to quantify macro and micronutrient intake is it can help to reinforce to the patient something that you've already identified through your subjective assessment. So I think that can often be an issue where people will be dismissive or not understand or appreciate the importance of diet. Yeah. But when you actually start to quantify it and they can see that, you can go, okay, this is why I actually want you to go and seek professional help for this.
I think that's important, because obviously you need to have, and I always try to do this, I always have that conversation with the individual to say, look, clearly it's not an area that I'm going to be making any recommendations, but I can obviously help you identify some of these things so that we can bring in health professionals that will be able to make the adjustments and guide you through this process. Because I think that's and that might be bringing in GP, it might be bringing in a sports physician, it might be bringing in a dietitian. All of those people will be involved in that process of working out, okay, what are your current macronutrient contents, your hormonal profile, what are your mineral status. And
this is where I think, like, getting to the crux of why we're having this conversation is bringing to people the attention of the importance of diet. And I think it's a good question to ask yourself, and I know we obviously do this a lot within our clinical practices, what kind of questions we ask people about their diet to identify, are there any potential factors that do need addressing? Because it's one thing to say, like, oh, what's your diet like? And someone says, oh, it's good. And you go, okay, could you describe to me what that actually looks like? And then they may start to see a particular or a very different story start to unfold.
Yeah, I think the key thing that you tend to ask them is two factors. I always, because it is sometimes sensitive, I ask them, is there anything that you don't eat?
Yeah.
Yep. And straight away, if they say, I don't eat meat or I don't eat animal products at all, that starts to open that conversation. Okay, well, what is
Absolutely.
The other one is, even if they say, no, I eat everything, I will typically ask them, what does a normal day of food look like for you?
Absolutely.
Especially if they're in an athletic population, I try to get an idea so that I can start to gauge, okay, does that roughly look like enough calories? You know, it is the calories in versus calories out thing, but also...
Which is very relevant, particularly in athlete populations, yeah.
Well, even as you said, as someone ages, you need to have that understanding as well.
Yes.
And then the second thing is I start to think about, okay, based on what they're eating, are they getting enough certain macronutrients, as like protein content for an older patient, or someone who's doing a lot of, say, heavy training and they need to be able to support their muscle mass. And then the last part is you start thinking about, are they probably getting enough of these micronutrient intakes? So yeah, the two typical questions I started with is usually, is there anything that you don't eat?
Yeah.
And then the second one I usually follow up, either way, tends to be, okay, can you describe a basic or a common day for you of what you would eat?
Yes, and understanding the more someone has a restricted diet, the more likely they're going to have a deficiency. Not to say that an omnivore who eats everything is going to have a perfect diet, because you might find that all they're eating is cereal and bread. But these are really useful things to at least understand from a more broad macro scale. Is there an issue here? Because for me personally, I have a particular interest in understanding nutrition and its importance, and I feel like I have a pretty good knowledge base on it. But for a lot of people, they may not have any knowledge base on it whatsoever. So starting from asking those bigger questions can be very useful to understand, do I see this as a potential factor associated with this person's presentation? Yeah,
and I think it really starts to give you insight when you start seeing the literature that's supporting some of these things. The second area we might look at is, say, muscle tissue and supporting that. There's two other areas, and we'll leave the complicated one maybe for last.
All right.
But in muscle tissue, what kind of things would you be looking to sort of optimize so that you can actually support, say, maintaining muscle mass, one, as you get older, and two, maybe if you're doing a heavy amount of resistance training or even just general physical training?
Yeah, well, look, this is a particular area that's been very well studied and established, and it's very clear that the importance of protein and overall amino acids, and we can perhaps prioritize certain ones, but also glycogen or carbohydrate consumption to ensure that you're actually restoring energy storages, because you know that depletion of glycogen will start to limit the anabolic response from resistance training. And I mean, this is why when you think about, say, protein supplementation is so big, because it's
well supported.
Absolutely. And it also makes a lot of sense too when you consider the importance of protein consumption for maintaining muscle mass, that if you can get it in a more easily consumed form, as opposed to
drinking, it's very easy rather than having to eat a piece of meat or... Well, actually, that opens up a second question is, now it's become very popular even in supplementation for plant-based proteins.
Yeah.
Where does the evidence sit on stuff like that? Is it the same? Do you get the same benefit? Is it better than having it from an animal source? What kind of literature is out there? You probably know better than I do.
Yeah, well, again, it's interesting to note that when you look at very more sensitive population groups, particularly like elderly and children, it becomes really evident how animal protein is far superior in terms of being able to maintain or increase muscle mass. It's actually even quite evident when you look when you look at just even the healthy population as well. And it makes a lot of sense too when you think about the differences in animal versus plant protein. The two being, one, animal protein is a whole food in the sense that it has all the essential amino acids and a certain particular ratio. Now, some people would argue that with plant proteins, you're starting to get these mixes where they try to create a better ratio in the essential amino acids.
If you say that, if, for instance, someone was like, I'm just not going to eat animal products, but they want to increase their intake, are they going to still get significant benefits from intake from plant-based proteins?
Absolutely, particularly if you're looking at ones... Well, there is one exception to that. There is actually some very good evidence looking at, say, soy protein. Now, there might be some other concerns about consuming a lot of soy, but because of its potential negative impact on your hormonal system. But putting that aside, there actually is very good evidence to show that it can be quite useful.
That's a good source for people who are not choosing not to consume animal products.
And there are some other ones where you might have a combination of, say, pea and rice. And they also do a lot of processing and add in certain enzymes to help with the breaking down and assimilation of nutrients. So it certainly is getting better.
But overall, if you want to support, say, muscle muscle tissue, protein's important. It's interesting in terms of, say, healing. Say if someone's had a strain type injury, there hasn't seemed to be a lot of that crossover of, say, an increase or over supplementation of protein to try and support that. Have you seen anything that kind of looks to try and do that in a similar way? We'll talk about tendon in a moment. In a similar way that they're trying to do with, say, tendon and collagen.
Look, I not off the top of my head, no. Not to say that it doesn't exist. I know that there are a lot of people who have looked at, say, just consuming high amounts of animal protein for recovery. There's mixed evidence for that, but that doesn't necessarily correlate then to what happens when you have an injury. Because when you have an acute injury, your muscle or protein turnover goes up a lot higher. So like it's actually quite clear when you just look at the basic pathophysiological process that your protein intake when you are injured, or even actually for that case, and have a lot of different types of disease states, is really important for making sure.
So we're not saying it's definitely the case because maybe the evidence isn't there, and if it is, but we haven't read it, we apologise. But potentially, it sounds on a theoretical level that it would be beneficial to, say, increase your protein intake in a period of healing from, say, muscle strain injury or something like that.
Yeah, what we can certainly take away is if you look at, say, post-injury or immobilisation, consuming more protein mitigates the atrophy that occurs from detraining.
Yeah. Okay.
So it's clear that for a healthy person, improving or maximising or maintaining a certain protein intake will maintain certain anabolic signals to mitigate the negative effects from the detraining that occurs. So, from that, we can start to speculate that it's probably going to have a lot of importance. And part of that also too is not just about providing the appropriate amino acids, but also thinking about how it can regulate the oxidative stress and inflammatory response too. And that's where, you actually have some quite good evidence of looking at what happens when you start to increase protein intake, that you actually start to see positive changes in your redox status, i.e. oxidative to antioxidative stress and the inflammatory response. And that's a really important thing because we know that so much of the healing process is based on how the inflammatory process is regulated over time. Because a lot of issues that people have with healing is not getting the upregulation of anti or pro-resolving mediators that start to then end that inflammatory response and make sure that the tissue goes through its normal healing process.
We're going to talk about tendon and collagen, right? It's become, a lot of research has been done that's starting to support this, stuff that was done at the AIS that even developed the, BSC products.
Yes.
A lot of work being done by Keith Barr that's supporting the idea of collagen intake, type 1 collagen intake, and particularly if it's taken also with vitamin C, tends to improve collagen laid down, particularly within tendon tissue. Right? But let's put that aside for one moment. Have you seen anything where there's suggestion that it supports muscle, healing as well in, say, injury states? Because we know that obviously so much of the muscle tissue is actually made up of the fascial structures.
Absolutely.
That are collagen.
Every single muscle fiber is surrounded in fascia. The reality is collagen is the most abundant protein in our body. And there actually is evidence showing that collagen consumption improves protein synthesis. What's really important to remember though is collagen cannot replace, say, animal protein, for instance, because collagen is very high in certain amino acids, non-essential amino acids, but it's not very high in some of the essential amino acids. So we have to remember that it's not something that
it's not going to be the building block for the actual muscle tissue, but
Correct.
It will be for the connective tissue structures that make up so much of the muscle complex. Absolutely. Or the muscle tendon complex.
But this is where I think it's useful to think of it from an evolutionary perspective, that through our evolution, the consumption of animal products were what made us human. But when we killed an animal, we ate the whole thing. Nowadays we basically eat all the lean cuts of tissue, say chicken breasts.
Yeah, things that don't have a lot of the sinew type tissue
Correct.
that people would associate with that connective structure.
Correct. Anything that you can cook quite quickly and it's quite tender and not chewy is typically low in collagen, as opposed to a lot of cuts of meat. We need to slow cook it in order for it to break down the collagen structure.
It creates that gelatin
Correct.
structure.
Things like brisket, things like lamb shank, lamb shoulder, and so on. And then in addition to things like consuming organs and bones as well, and skin is also another really important one. So yes, collagen does have a very important role for protein synthesis in muscle, and I would say that maximizing the nutritional support for muscle, whether it's related to hypertrophy or injury, collagen consumption is going to be really important, because you're not just disrupting the actual myofibrils, you're actually disrupting the collagen network itself. So that's going to be going through remodeling.
In tendon, it's starting to become clearer and clearer that supporting, say, a tendinopathy or some sort of tendon pain with collagen seems to be very effective.
Yes.
Right? So it's become this thing where nearly everyone that we speak with, we're having these conversations, say if they have an injury to a tendon structure, we're having these conversations about collagen intake, whether it be from, as you said, whole food sources or whether from supplementation. Can you share some of the interesting research about some of that? I think actually in last week's podcast, I think you discussed this, but
I feel like we've spoken about it a couple of times.
Yeah, but for those who are interested, actually, at least, and we won't go into it again, have a look at some of the studies that have been done. As I said, Keith Barr's work, he started to look at this in some reasonable depth, and there is a case study that he presents on a basketball player that was in the NBA, I believe, who showed that it was actually quite over a long period of time that he was able to maintain this with utilization of collagen supplementation and an isometric loading protocol.
Yeah, and putting aside perhaps some of the structural changes, it's clear that some of the subjective and physical outcome measures definitely improve. A lot of Keith Barr's research has supported that.
Now, the question again, this goes into that contentious area, can you get collagen from both animal products and from plant-based products?
Yeah, this one's nice and clear because the answer is no. Yeah. So collagen is something that's unique to the animal kingdom.
The question that I've had from people is, can you, some things you can synthesize. Can you synthesize collagen naturally?
So, yeah, again, collagen, the main amino acids are glycine and proline, which are non-essential amino acids. But this goes back to the point before of some of these non-essential amino acids are now starting to be labelled as semi-essential or conditional. The reason for that is, although that your body can synthesize some of them, if you look at people who have a low collagen diet, the amount of these amino acids they have in their blood, in their plasma, is a lot lower. So what it shows is, if we want to say optimize our fascial system, we need to actually consume collagen to make sure that we have enough. And I think that becomes much more obvious when you look at athletic populations, because their collagen turnover is going to be a lot higher based on the mechanical stresses that they're applying to their body.
I haven't looked into this yet, but it's a working hypothesis that I have around collagen intake and bone healing. Have you seen anything on that as yet?
Yeah, no, I'm not. I actually haven't. But again,
it makes about 30% of bone is collagen.
Totally, yeah. And again, this comes back to the quality of the actual collagen structure itself, because we need collagen as essentially the scaffold in which we apply stresses to the bone and be able to.
Yeah, it gives bone some of its flexibility. It's
absolutely.
And it makes up a significant portion of the tissue. You would think that in a similar manner, supporting, say, bone healing or even general bone health with collagen would be useful.
Yeah, absolutely. Look, I haven't really looked into it much, but I don't think there's much, or if there is anything on that.
I've just been thinking about that a fair bit recently, with some of the patients that I have, of whether there would be some sort of hopeful carryover with that. I think, before we move on to the last...
Is there anything else you want to talk about with tendon?
No, unless you've got something for us.
No, I think... I think it's actually a really good example of a big missing piece of the puzzle. And because when we think about tendon, there's obviously the mechanical factors that are...
Well, for the longest time, tendon was seen as being a really difficult thing to treat.
Absolutely.
Now it's becoming clearer and clearer. And take of it what you will when it comes to the mechanical stimulus. There's been evidence, initially it was the work looking at being able to Alfredson's eccentric program. Then it was a combination of eccentric with other things. Then it was, progressive stuff. And now there's been a lot of support looking at isometric loading and that in combination with the more progressive utilization of all the different things across the force velocity spectrum. It seems like if you apply mechanical stimulus that is, the magnitude is significant enough to create change for that individual, whatever their current capability is, as well as have the support for the building blocks, particularly collagen, you tend to start seeing some much more positive outcomes.
Yes, and what's also important to remember is the metabolic window in which you see adaptations to well-organized connective tissue structures like tendon, because one thing that seems to be important is when you consume collagen as well, because and that makes a lot of sense when you think about how tendons actually draw in nutrients. They essentially act like a sponge. When we apply mechanical load, you're squeezing the fluid out of them, which also changes its viscoelastic properties. That primes it for being able to be more elastic in nature, but then as it relaxes, it's going to draw fluid in from its surroundings or the interstitium, and based on what's actually in that fluid and including the plasma is going to determine what kind of nutrients.
So you want that nutrient available then, and that's, I think, with all the protocols they talk about having it approximately about an hour before doing the physical activity.
And that's very different to say muscle, where the metabolic window is much larger because it's much more vascularized and typically has much more metabolic activity even at rest. Yeah,
the work, if you look at, say, Stu Phillips' work, he sort of suggests that you're almost better off not necessarily thinking, I've got to have my protein straight after exercise or anything like that, but rather having enough protein across the day, and usually equal. He talks about equal boluses, 3 or 4 times a day, having, in each meal sort of thing, have enough protein so that your body consistently has that within its blood or plasma.
Yeah, and actually that's a really useful thing to consider too when we think about like what are the type of questions we ask patients about their diet. Is thinking about when they're getting certain macronutrients as well, because that's a real food timing is really, really important, particularly with regards to athletic performance.
The last area that I wanted to talk about, which is probably an area that at the moment there's very little evidence, so we're trying to shine a bit of a torch into maybe the future, which is cartilage.
Yep.
And particularly articular cartilage. At the moment, and we had this conversation with a couple of the surgeons they've been on, I feel like at the moment we're nowhere when it comes to cartilage regeneration. It seems like surgery for joint replacement is your best option, right? And for some things, like say hip replacement or knee replacement, they're pretty good options. But it would be nice to be able to say I'm maintaining or expanding on my cartilage health. Now, the key difference with cartilage compared to say something like other connective tissues is that it is predominantly type 2 collagen, which has slightly different properties. But type 2 collagen is something that we typically don't get very much of it all in our diet. And so I'm working with this completely unsupported hypothesis that one of the reasons that we don't see the benefits of, say, mechanical loading on joint articular cartilage is because we don't actually have anywhere near adequate building blocks in order to support that. It seems like in all other tissues, if they have those building blocks and they get the mechanical stress, you get this nice marriage where there's a nice adaptation and improvement in the, say, whether it's quality or density or whatever. And some things it's just maintaining, say for bone or muscle mass. As we get older, it's just about maintaining muscle mass, or it's just about maintaining bone density rather than increasing it. But it would be nice even to maintain our cartilage over a period of time. I put this question to you, and again we say we have no evidence to support this at the moment, but do you think that if we do get to the point where, say, type 2 collagen becomes similar to type 1 collagen supplementation, or even consumption from products, that we may see some changes in that space?
Well, it's plausible, isn't it? Now, in saying that, there actually is some evidence showing how type 2 collagen can have positive effects for...
I'm saying it's early on.
It's definitely early, yeah. But there's certainly some evidence showing that subjectively you see improvements in it. Pretty sure, actually, I think it was that article that you sent, the recent one on looking at nutrition for athletic injuries, where Keith Barr was a co-author of looking at, I think they used hydrolyzed collagen of looking at cartilage thickness and actually seeing some improvements in that. So,
well, we know that we see improvements in cartilage thickness with people who've been exposed to physical activity, particularly, say, progressive resistance training, sports, things like that, over time. They actually have thicker articular cartilage.
And that's, again, very obvious in looking at childhood and adolescent development.
Exactly. So we know that actually you can basically grow more articular thickness and potentially quality if you expose people to that mechanical loading through the development years. Can you support that and enhance that by having the nutritional status? We don't know the answer. Maybe there's some foundation for it.
Well, the other thing I think too, and it might be interesting to see this with regards to, say, type 1 collagen and tendon health, is the whole food versus the processed form. And why I say that is because if you're taking a whole food, like let's say for instance you had tendon broken up into capsules and you consume that as a supplement, you're not only going to get type 1 collagen, but you're going to get all these other important factors within the extracellular matrix. So things like hyaluronan and all the glycosaminoglycans, in addition to the other cofactors when we think about micronutrients like vitamin C or copper is a really important one. And the same goes for cartilage, because the thing that gives cartilage its compressive strength is the collagen type 2 network essentially acts like a net or a scaffold that then traps hyaluronan and all the glycosaminoglycans, which hyaluron forms the backbone, and water to create essentially
that
hyaluron
spongy
cartilage.
kind of,
So my question is if we follow the same principles that we've seen with some of the early evidence of hydrolyzed collagen,
apologies for the audio, it's absolutely pouring rain outside.
With hydrolyzed collagen is, when we think about cartilage tissues, if we consume type 2 collagen with regards to loading, because we know that articular tissue has the same process of bringing in nutrients by essentially acting like a sponge, but pushing fluid out, and then as it rests bringing fluid back in, of bringing in that type 2 collagen in addition to the glycosaminoglycans. So it actually has the building blocks to be able to regulate the extracellular matrix. The other part though with that is, are the chondrocytes within the cartilage sensitive and functioning normally? Because one of the other things that we know when we look at, say, osteoarthritis or people with metabolic syndrome or dysfunction is that can create senescence within the chondrocytes themselves. So you can be giving them all the nutritional support and mechanical loading, but if there are some indications of poor physical health and well-being, particularly related to their
you won't get the uptake.
Metabolic dysfunction, you might not have the chondrocytes functioning appropriately to be able to regulate the extracellular matrix.
Well, I think that's touched on most of the areas that we wanted to get to. I think, as I said, I want to reiterate again that we hope that this is given particularly practitioners, or even if it's athletes or people with general populace listening, the idea that you should be considering these things, and then if you feel like there is opportunity for improvements there, seeking out a health professional, particularly in the nutrition and dietetic space, that will be able to guide you through that process. Once again, this episode of Lateral Think is brought to you with the support of Strength by Numbers. Strength by Numbers have created an integrated clinical and sports performance system. The AXIT system uses force plates, dynamometry and strain gauges to objectively measure everything from isolated movements to sports performance tasks. The system has greatly enhanced our clinical practice, decision making and objectivity. We are no longer guessing. The greatest thing is its ease of use for both practitioners and clients. There are no wires, no fixed setup. It is a fully integrated Bluetooth system. If this sounds like something that would enhance your practice, visit strengthbynumbers.com and tell them that Melbourne Athletic Development sent you.